So what exactly is rib remodeling, and how does it differ from traditional waist contouring? Rib remodeling is a minimally invasive procedure that allows me to put a small fracture in your rib. You wear a corset post-op, and that allows your rib to slowly contour, bend in to give you about a 3 to 5 inch reduction in your waist. The procedure is always done under general anesthesia, and it's extremely safe because we use ultrasound. So which ribs are addressed during rib remodeling surgery? Well, we always address the floating ribs, and that's typically ribs number 12 and 11. Those are not directly attached to your rib cage. In addition, I often address some of the false ribs, and those are ribs number 10, 9, and often rib number 8 to give you a nicer contour. So I was the first person in the US to start doing the front rib procedure. So combined with the back ribs, I often do the front ribs as well to help decrease rib flare and give you an even more dramatic result. So who is an ideal candidate for rib remodeling? Well, you have to be healthy with no medical comorbidities such as diabetes, high blood pressure, or heart disease. In addition, you don't want to have a lot of loose skin. So if you've had children and you need a tummy tuck, we often recommend doing that procedure first or in combination with rib remodeling. Patients that have had liposuction before and have minimal fat to remove are often good candidates as well. If you do rib remodeling with a lot of excess fat below your skin, your results won't be as dramatic as you're hoping for. Overall, the majority of people are good candidates for rib remodeling. As long as you're healthy and you have a healthy BMI, you're usually a great candidate for the procedure. Who is not a good candidate for rib remodeling? Patients that are overweight, have a high BMI, often don't get the results they're hoping for. This is usually due to visceral fat, which is the fat around your organs, your liver, your stomach, your kidneys, because with that excess fat, the ribs do not move inwards the way we want them to. How does rib remodeling enhance your results when combined with liposuction or BBL? Well, as you know, liposuction removes unwanted fat from areas, particularly the stomach, the back, the arms, the love handles, etc. Often with liposuction, we'll see a 2 to 3 to 4 inch reduction in your waistline alone. But some people just have a boxy frame. They have very wide ribs and they have wide hips, and so they always have a boxy figure. So when combining rib remodeling with liposuction or a BBL procedure, and often a tummy tuck, you'll get more of that hourglass silhouette that you've always wanted. How permanent are rib remodeling results? After surgery, we have you wear a corset for a minimum of 3 months. The reason why is we want that bone to form and heal in its new position. Over those 3 months, new bone is forming. And once that new bone forms, those results are permanent. So we recommend you wear that corset around the clock, and you only take it off to get a massage or shower, and you put it right back on. The patients that are diligent about wearing corsets get the best results. Does rib remodeling affect breathing, core stability, or your posture? And the answer is it doesn't. So we're moving the ribs in a few centimeters on each side, and that often leads to a nice 3 to 5 inch reduction in your waist. However, we never put your internal organs at risk. Believe it or not, a tummy tuck can reduce your waist measurements more than just rib remodeling. So when you combine the two, it's an even more dramatic result. The short answer is no, your breathing will not be affected. You'll have pain in the short run, and that's expected, and we'll help you treat that pain. But by wearing your corset, most of that pain will be relieved and you'll be able to breathe just fine. Am I okay to get pregnant after doing rib remodel? Believe it or not, you can, and there are no issues. We've had patients that have gotten pregnant after rib remodeling, and it does not affect their baby or the pregnancy whatsoever. It's a very safe procedure that has no limitations on your future quality of life or activities once those bones are healed. So what safety measures do I take during the rib remodeling procedure? Well, for me, I always do the procedure under general anesthesia, because that way we can breathe for you during the procedure and give you pain medications, and that helps to keep you safe. I always use the ultrasound. That helps me know exactly where I'm at, and so I avoid injury to surrounding structures such as the lung. Understanding ultrasound is essential and key to safe rib remodeling surgery. In addition, I always get imaging beforehand, because oftentimes patients have ribs that are missing or different anatomy on the left versus the right. So with a combination of a CT scan and ultrasound, I have all the tools I need to keep you safe. So how long does rib remodeling surgery typically take? Well, it's done under general anesthesia, and it typically takes just under an hour, depending on how many ribs we're doing and if we're doing the front and or the back ribs. After surgery, you can go home. We put you in a corset and you're going to wear that corset for about 3 months. So what makes my rib remodeling technique different from others? I trained on this procedure over 2 years ago in Brazil. So I trained from 8 different surgeons and learned multiple ways to do this technique. With that combination of knowledge, I feel like I was able to bring something back to the United States that other surgeons weren't able to have. I do multiple things to help ensure your safety, but also my goal is to always give you the maximal result. You may see clicky videos when you hear a pop in the rib, and that's great and all, but sometimes that's not all that's required. And so I have some techniques up my sleeve that I use to make sure that you stay safe, but also get the best results. So it's not all about clickbait for social media. It's about results when it's all said and done. So what are the common misconceptions about rib remodeling? Well, number one, we never remove your ribs. That is more of an antiquated procedure, even though there are still people who do that. Your ribs stay in place and they still continue to protect your organs. After rib remodeling surgery, your internal organs are not at risk. Your lungs will still function normally. Your kidney, liver, and spleen, they will all continue to function normally. It is a very safe procedure, and like I said, we never ever remove your ribs. So what does rib remodeling recovery look like week by week? You're just really wearing a corset and limiting your physical activities. As far as going back to the gym, I'm probably not going to let you lift weights for about 2 months because we really want those bones to heal, and we want that good permanent result. So the less active you are while you're recovering, the better it is. Most patients have a little discomfort for about the first 2 weeks, and don't get it wrong. It is a little bit painful. You are breaking your ribs, but we give you a lot of pain medication, including ibuprofen, Tylenol, and some strong narcotics, and that really helps you get through that first week. Is rib remodeling more effective for certain body types? The answer is yes. For people that are a little bit leaner, you're going to see a slightly better result. In patients that are really muscular or have a really masculine frame, the rib remodeling procedure doesn't work as well because you have those strong muscles that are resisting the forces of the rib remodeling. So not everyone is a perfect candidate, but a consultation will help determine if you're a good candidate for the procedure. So what role does the corset play in rib remodeling? Corset is everything. I essentially do the same procedure for each patient. Your results will be determined by how well you wear that corset. You literally need to wear that corset for 23.5 hours a day. You eat in it, you sleep in it, you go to work in it. Because after I break that rib, you need some sort of stabilization to bring that waist in. Our goal is to have that rib heal in that new curved position. So if you never wear your corset, that rib will go back to its original shape. So the corset is everything. Will rib remodeling change the way my clothes fit? And the answer is absolutely yes. You'll see about a 3 to 5 inch reduction in your waist, and so you'll see that hourglass silhouette come through in all of the clothes that you wear. Can I get revision rib remodeling surgery if I've already had the procedure done once? Yes. Oftentimes it depends on your previous surgeon's technique or how you wore that corset. So I have done revision procedures from patients who have had rib remodeling done elsewhere. We do require another CT scan to see how your bones heal. Oftentimes we'll find that our technique will allow for a better postoperative outcome with revision surgery. So short answer is yes. You often can get rib remodeling done a second time. Can rib remodeling be combined with other procedures? And the answer is yes. We often combine the procedure with liposuction or a Brazilian butt lift. It can be combined with a breast augmentation or a breast reduction, and even a breast lift with implants. Another common question is, can it be combined with a tummy tuck? And the answer is absolutely yes. A combination of liposuction, muscle repair, and rib remodeling will give you that smallest waist possible.